Hello everyone, this is Dr. Swapn and you're watching my YouTube channel Dental Expertise, where we explore previous year dental questions. I'm going to complete this question paper today, and if you want to see explanation of these questions, I will share the explanation video link in the description box. Before we start, I request you all, please like and subscribe my channel and share with your colleagues and keep motivate me. Now let's get started. Which of these lesions are typically within soft tissue and may mimic inflammatory lesion of the odontogenic origin? Options are median alveolar cyst, globulomaxillary cyst, nasolabial cyst, and nasopalatine cyst. And the correct answer is nasolabial cyst. Nasolabial cysts are typically within the soft tissue and may mimic inflammatory lesion of the odontogenic origin. And medial alveolar cyst, globulomaxillary cyst, and nasopalatine cyst. These cysts are hard tissue cyst. Okay. Next question is mass of histologically normal tissue present in an abnormal location is called. Options are teratoma, choriostoma, hematoma, none of the above. And the correct answer is choriostoma. Okay. Mass of histologically normal tissue present in an abnormal location. It is called choriostoma. Cretinism is deficiency disease caused by the congenital absence of. Options are thyroxine, insulin, calcitonin और epinephrine. तो क्रिटिनिज्म जो है एक डेफिशिएंसी डिसीज होती है, किसकी कॉन्जेनिटल एब्सेंस के कारण होती है? ऑफ द थायरॉक्सिन. ओके, इट मे बी absent from the birth or before the birth. So the correct answer is thyroxine. The sum of mesiodistal width of the primary molar in any one quadrant. And the correct answer is sum of mesiodistal width of the primary molar in any one quadrant is 2 to 5 mm greater than the permanent teeth that succeeds them premolars. Okay. Which of the following is not the principal characteristic of attention deficit hyperactivity disorder? Options are inattention, mental retardation, hyperactivity or impulsivity. अटेंशन डेफिसिट हाइपर एक्टिविटी डिसऑर्डर के कैरेक्टरिस्टिक सिम्टम्स क्या क्या होते हैं? इनअटेंशन, हाइपर एक्टिविटी एंड इम्पल्सिविटी. एंड मेंटल रिटार्डेशन इज नॉट द प्रिंसिपल कैरेक्टरिस्टिक ऑफ अटेंशन डेफिसिट हाइपर एक्टिविटी डिसऑर्डर. ओके, सो द करेक्ट आंसर इज मेंटल रिटार्डेशन. Koplik spots are associated with. Options are smallpox, German measles, mumps or rubella. And the correct answer is measles, rubella. Koplik spots are associated with measles, rubella. Okay. At age of 6 years of child's head is what percentage of its adult size? Options are 30%, 50%, 80% or 90%. And the correct answer is 90%. At the age of 6 years, a child's head is 90% of its adult size. Normal prothrombin time is. Options are less than 7 seconds plus minus 2 seconds, less than 11 seconds plus minus 2 seconds, less than 14 seconds plus minus 2 seconds, less than 25 seconds plus minus 2 seconds. And the correct answer is less than 14 seconds plus minus 2 seconds because prothrombin time normal range क्या होती है? 9.4 to 12.5 seconds. Okay, so the correct answer is less than 14 seconds plus minus 2 seconds. Next question is, in patient with Leaford fracture, common findings in paresthesia over distribution of the. Options are infraorbital nerve, inferior alveolar nerve, mylohyoid nerve or hypoglossal nerve. तो जो पेशेंट होते हैं लीफ फुट फ्रैक्चर के, उनमें क्या कॉमन होता है कि उसमें इंफ्रा ऑर्बिटल जो पार्ट होते हैं, इंफ्रा ऑर्बिटल पार्ट जो है इन्वॉल्व होते हैं, इसलिए कौन सी नर्व जो है वो कॉमन फाइंडिंग में होगी पैरेस्थीसिया के? इंफ्रा ऑर्बिटल nerve. Okay, in patient with leaf fracture, common finding is paresthesia over distribution of the infraorbital nerve. Next question is secretion of sublingual gland is predominantly, options are mucus, serous, mixed, and none of the above, and the correct answer is mucus. Okay, secretion of sublingual gland is predominantly mucus. Parotid glands are serous, submandibular glands are mixed, and sublingual glands are mucus. Okay, तो आपको ये याद रहेगा. Major arterial supply to temporomandibular joint is derived from the, options are facial artery, angular artery, occipital artery, superficial temporal artery, and maxillary artery, and the correct answer is superficial temporal artery and maxillary artery supply to the temporomandibular joint. Okay, next question is incipient curious lesion after sealant applications. Options are progressively increase in size, are arrested, spread rapidly into interproximal area, remain the same, and the correct answer is are arrested. Incipient carious lesion after sealant application are arrested, and it doesn't progressively increase in size. Okay, RPI clasp is a type of, options are gingivally approaching clasp, occlusally approaching clasp, mixed clasp, or infrabulge clasp, and the correct answer is infrabulge clasp. RPI clasp is a type of a infrabulge clasp. Infrabulge clasp has 5 types: T clasp, modified T clasp, Y clasp, I clasp, and RPI clasp. So the RPI clasp is a type of infrabulge clasp. R is stand for rest, always mesially. P is stand for proximal plate, which is placed distally, and I stand for I bar, which is placed buccally. Okay. Next question is optimum location of finish line for all ceramic anterior full veneer crown should be supragingival, subgingival, equigingival, or subgingival labially, and supragingival lingually or palatally, and the correct answer is equigingival. Optimal location of finish line for all ceramic and anterior full veneer crown should be equigingival. Why? Because it is aesthetically accepted, and it has accessible margin placement. Okay, so the optimum location of finish line for all ceramic anterior full veneer crown should be equigingival. Next question is which class of antibodies constitutes about 75% of the antibodies of a normal human being? Options are IgA, IgD, IgE, IgG, and the correct answer is IgG. IgG constitute about 75% of the antibodies of a normal human being, and IgA constitute 15%, and IgM constitute 10%. Okay, and IgG is 75%. Spoon denture may be indicated for which classification of partially dentulous arches? Options are Kennedy class 4, Kennedy class 1, Kennedy class 2, Kennedy class 3, and the correct answer is Kennedy class 4. Spoon denture may be indicated for Kennedy class 4 of partially edentulous arch. Porcelain etching for ceramic repair involves the chemically which material? Options are orthophosphoric acid 37%, hydrofluoric acid 9%, phosphoric acid 33%, or maleic acid 20%, and the correct answer is hydrofluoric acid 9%. Porcelain etching for ceramic repair involves hydrofluoric acid 9%. Guide planes are, options are proximal surface of distal surface of fixed partial denture, proximal surface abutment teeth parallel to the path of insertion and removal, proximal surface of retainer of RPD, vertical arms of RPD retainer. And the correct answer is proximal surface abutment teeth parallel to the path of insertion and removal. Guide planes are proximal surface abutment teeth parallel to the path of insertion and removal. Which luting cement is not preferred for all ceramic restoration? Options are resin cements, glass ionomer cement, polycarboxylate cement, resin reinforced glass ionomer cement. And the correct answer is glass ionomer cement is not preferred for all ceramic restoration. Next question is, Carey's activity is not directly proportional to the, and the correct answer is quantity of a fermentable carbohydrate ingested. Carey's activity is not directly proportional to the quantity of the fermentable carbohydrate ingested. Okay. Which one of these is not a component in implant supported crown? Options are abutment, analog, impression coping or pontic. And the correct answer is pontic. Pontic is not a component in implant supported crown. Abutment, analog and impression coping are the component in the dental implant, and pontic is not a component in the implant. Which of the following is not the response of histamine released due to allergic reactions? Options are vasodilation, bronchoconstriction, increased blood pressure or secretion of HCl. And the correct answer is bronchoconstriction. Bronchoconstriction is not the response of histamine released due to allergic रिएक्शन. ओके, तो एलर्जिक रिएक्शन होती है तो उसमें ब्रोंकोकॉन्स्ट्रिक्शन नहीं होता है. ओके, नेक्स्ट क्वेश्चन इज विच ऑफ द tooth would have 2 canals most of the time? And the correct answer is tooth number 45. Tooth number 45 have 2 canals most of the time. Persistent radiolucency in the periapical area of endodontically treated maxillary first molar could explain by, and the correct answer is second mesiobuccal canal was not located. Okay, persistent radiolucency in the periapical area of endodontically treated maxillary first molar could explain by second mesiobuccal canal was not located. Which tooth is most likely to have a curved root? Options are maxillary central incisor, maxillary lateral incisor, maxillary canine or mandibular central incisor. And the correct answer is mandibular central incisors as most likely to have a curved root. Tissue conditioners are used for completely edentulous patients. Why? To remodel the alveolar bone favorably, to bring the tissue tone to normal, to alleviate any sign of tissue inflammation before a new denture is fabricated, showing signs of oral candidiasis. And the correct answer is to alleviate any signs of tissue inflammation before a new denture is fabricated. Okay, tissue conditions are used for completely edentulous patient to alleviate any signs of tissue inflammation before a new denture is fabricated. Diagnosis of ulceration on tongue persisting for more than 2 weeks should be based on, अगर अल्सरेशन होगा टंग पे जो कि परसिस्ट कर रहा है मोर देन द 2 वीक्स, एंड इट शुड बी बेस्ड ऑन incisional biopsy. Okay, diagnosis of ulceration on tongue persisting for more than 2 weeks should be based on incisional biopsy. Which one of the material is not used for the dental implants in clinical use? Options are commercially pure titanium, grade 5 titanium, titanium 6 aluminium 4 volt alloy, cobalt chromium molybdenum alloy. And the correct answer is cobalt chromium molybdenum alloy is not used for the dental implants in clinical use. अगर ऑप्शन में कोबाल्ट क्रोमियम अलॉय होता तो ये आंसर करेक्ट होता, मतलब कोबाल्ट क्रोमियम इज यूज फॉर द डेंटल इम्प्लांट्स. but cobalt chromium molybdenum alloy is not used for the dental implants in clinical use. Next question is, what type of occlusion scheme is preferred for the maxillary complete denture opposing mandibular natural dentition? And the correct answer is bilaterally balanced occlusion. Okay. Bilaterally balanced occlusion is preferred for maxillary complete denture opposing mandibular natural dentition. Which one of following communicable disease commonly infect dental health personnel? And options are AIDS, hepatitis B, hepatitis C or SARS. And the correct answer is hepatitis B is commonly infect dental health personnel. तो आज का ये क्वेश्चन पेपर कंप्लीट होता है. नेक्स्ट वीडियो में स्टार्ट करेंगे हम नए क्वेश्चन से, नए क्वेश्चन पेपर से. अगर वीडियो पसंद आई हो तो प्लीज़ लाइक एंड सब्सक्राइब माई चैनल. थैंक्स फॉर वॉचिंग.